po kasi, this is not an official variant of concern or even an official variant of interest. Ang World Health Organization po ang nagsasabi, ang nagde-designate ng variants of concern and variants of interest. IHU is the name of an institute in France po that described this particular lineage of the virus. And the WHO has already been monitoring this since November of last year. Ito po yung lineage na B.1.640. At so far, wala naman, marami po siyang mutations, pero wala naman siyang pinapakitang parang survival advantage or immune evasion na nakikita natin sa Delta or sa Omicron. It's a variant that is being monitored, but it is not yet as concerning as Omicron or Delta or even the other ones like yung Alpha, Beta at Gamma. So ito po ang release ng WHO. Ang sinabi po nila, it is not a threat at this time. So it is something that we are monitoring. And even the people who wrote the paper from IHU, ang sabi nila, it is too early to speculate on the virological, epidemiologic, or clinical features of this IHU variant. So the bottom line po, Mr. President, is we will continue to monitor this po. But right now, I think our attention really has to be on Delta and Omicron because this is really wreaking havoc all over the world. Next slide, please. I think that's the plan. So, in summary po for IHU, IHU is not a variant of concern. It is not exhibiting increased infectivity or immune evasion at this time. So, gumagana po yung bakuna natin for this.
Hey mga ka-alerto, sabay-sabay po nating panoorin itong sinasabi ni Pangulong Duterte na merong bagong variant. Ito yung IHU at yung update ng Omicron. So, pakinggan po natin si Pangulong Duterte at yung isang doktor na si Dr. Salbana para po ma-update po tayo at magkaroon tayo ng kaalaman para dito sa mga virus na ito. So, sila na po ang bahalang magpaliwanag para po hindi naman tayo mga expert para magpaliwanag dito. So, sabay-sabay po nating panoorin.
Legal persons relied upon the government to give us what should we do? How should we treat it? There are already implemented programs, but if there is something that we can offer in addition, we would be happy to hear from Dr. Excel Salvania, member of the Technical Advisory Group for COVID-19 and infectious disease expert. Dr. Salvania, you have the floor.
Good afternoon, Mr. President. Good afternoon to the cabinet members and to my fellow resource persons. May I have my slides up, please? All right, Mr. President. So I'm just going to give a quick briefing about IHU. And latest also on Omicron. Next slide, please. Next slide, please.
What's happened with the technical guys?
Diba? So yung IHU po kasi, this is not an official variant of concern or even an official variant of interest. Ang World Health Organization po ang nagsasabi, ang nagde-designate ng variants of concern and variants of interest. IHU is the name of an institute in France po that described this particular lineage of the virus. And the WHO has already been monitoring this since November of last year. Ito po yung lineage na B.1.640. At so far, wala naman, marami po siyang mutations, pero wala naman siyang pinapakitang parang survival advantage or immune evasion na nakikita natin sa Delta or sa Omicron. It's a variant that is being monitored, but it is not yet as concerning as Omicron or Delta or even the other ones like yung Alpha, Beta at Gamma. So ito po ang release ng WHO. Ang sinabi po nila, it is not a threat at this time. So it is something that we are monitoring. And even the people who wrote the paper from IHU, ang sabi nila, it is too early to speculate on the virological, epidemiologic, or clinical features of this IHU variant. So the bottom line po, Mr. President, is we will continue to monitor this po. But right now, I think our attention really has to be on Delta and Omicron because this is really wreaking havoc all over the world. Next slide, please. I think that's the background. So in summary po for IHU, IHU is not a variant of concern. It is not exhibiting increased infectivity or immune evasion at this time. So gumagana po yung bakuna natin for this. WHO is monitoring it, pero hindi pa po siya VOI or VOC. It's designated as a VUM po. Actually, nanay niya yung designated na VUM, hindi 1.640. The thing to remember po is that yung mutations po natin, kahit madami pa yung mutations, they do not necessarily translate into immune evasion or more transmissibility. Kung naalala niyo po, Mr. President, yung T3 natin or Theta na describe una dito sa Pilipinas, dati po naging VOI yun, it was called Theta, tapos naging VUM, variant under monitoring, tapos natanggal na lang siya. Nakakatakot siya kung titingnan natin yung mutations niya, but it did not pan out. Actually, tinanggal na siya sa monitoring. So hopefully, ganito rin po yung mangyayari sa IHU. But of course, we have to continue to be vigilant kasi marami po talaga itong na-generate na variants, especially among people who are not vaccinated. Yung mga hindi po bakunado, mas madaling mag-mutate po yung virus sa kanila. So in a way, if we vaccinate a lot of people, we are also preventing the emergence of these variants. So ang conclusion po ng WHO is that IHU is not a threat at this time. Next slide po. So just to update you, Mr. President, on Omicron, and we are getting more and more data about this, it really is more transmissible than Delta, particularly because yung vaccines na hahawa pa rin kahit fully vaccinated. Although our vaccines continue to work naman to decrease the risk of severe disease. It is less deadly compared to Delta. Nakita na po yan in comparing 500,000 people with Omicron and 500,000 people with Delta in the UK. You are 3 times less likely to get hospitalized with Omicron compared to Delta. And of course, that goes down even more kung bakunado po kayo. And the vaccines significantly still protect against severe disease. Giving boosters will add more protection, and vaccines also decrease infectiousness and risk of mutation. So if you're vaccinated, may chance na mahawa ka, pero most likely, magiging mild po yon. And even yung paghawa mo sa ibang tao, yung risk goes down kasi mas mababa po yung amount of virus that you release into the air. Next slide, please. So ito po yung naging curve po sa South Africa, yung sa Gauteng province nila. Nakita po natin, mataas yung number of cases, yan po yung sa December, mataas, pero yung admissions are not so high. And very, very reassuringly, the deaths are not following the rise in cases. Of course, pwede pang magdagdag yan, pero we don't expect it to be as bad as Delta. Kasi kung titingnan nyo po yung graph before that, yung pagtaas po, kasama po yung hospitalizations at yung deaths, halos sumasabay sila. But for Omicron, kasama na rin the fact that there are some vaccinated people in Gauteng, hindi po talaga sumasabay yung death. So even if we're seeing many, many cases, basta mataas ang vaccination rate natin, we hope that the number of people who will end up in the hospital will remain relatively smaller and the number of people who will die will remain low. The problem is, yun nga, pati yung healthcare workers natin nagkakasakit eh. So, kailangan po talaga natin din silang protektahan. Next slide, please. So, ito rin po yung pinakita sa ages, yung Omicron wave across the board po, whatever age, mas mababa po talaga yung risk that someone will end up in intensive care compared to Delta. So, it is not zero. So, meron pa rin talagang magkakasakit, magkakaroon ng severe, but it is about half that of Delta. So, in a way, that helps us because then yung healthcare capacity natin will hopefully, as long as maraming bakunado and we can keep infection rates under control, we may be able to cope. May laban po tayo as long as mataas ang vaccination rates. Next slide, please. So even in South Africa, sobrang taas po ng cases nila, but then it started to go down in a matter of about 4 weeks. So magpipik po talaga ito na mabilis. We expect na mabilis po talaga yung pag-akyat ng cases na nakikita po natin, but hopefully we follow the trend that happened in South Africa, very quickly bumaba rin. Dahil kung maraming bakunado, mauubusan rin ng hosts eventually itong Omicron. Ang problema po natin yung mga provinces na mababa pa ang vaccination rate, pag makaabot ang Omicron doon, baka sila ang magkaroon ng severe disease if mababa pa yung bakunado, especially among the vulnerable population. But here in Metro Manila, Mr. President, we are hopeful as long as we can keep our healthcare system open, that even if we see 20, 30, 40,000 cases in the next few days, as long as many of those are vaccinated, the stress on our healthcare system will be manageable. Next slide, please. So how do we prevent Omicron? Our face masks, our face shields, physical distance, these still all work. Ang problema po kasi talaga, it's not 15 minutes na lang eh. Fleeting contact lang, pwede kang mahawa from Omicron. It's very, very contagious. And it spreads very fast. If it takes 5 days to get symptoms from Delta, it only takes 3 days to get symptoms from Omicron. So mabilis yung paghawa niya kasi when people have symptoms, mas nakakahawa sila. The treatment is the same for the most part. We are able to treat the most severe patients with the medications that we have. But it is also very important po na we have to keep our hospitals open. We have to prioritize the sickest of the sick. Kasi hanggang ngayon meron rin po mild tsaka moderate na napupunta pa rin sa hospital, and that is crowding out people who really need to be in the hospital. So we hope that as long as maraming nabakunahan, we can actually take care of these people at home safely, because the risk of bad disease kung Omicron yan and fully vaccinated sila is very low. Parang sa flu lang po. So again, basta bakunado, kahit mahawa ng Omicron, chances are it's going to be mild. It's going to be like the cold or the flu. And as long as they are able to isolate as soon as possible para hindi sila makahawa sa ibang tao, we will hopefully be able to ride out the Omicron wave. Next slide. So in summary po, ang Omicron po, mukhang milder po talaga siya than Delta, which is good news. But the bad news is it is very transmissible. And then the good news is that the vaccines will prevent severe disease. They continue to work. And if you get Omicron and you are vaccinated, most likely mild lang po talaga. Even my own patients nakikita ko, nung nasa Delta po, pag meron po silang Delta, yung lungs po nila, sunog na sunog po talaga. Pero ngayon, itong mga Omicron patients po, lalo na yung fully vaccinated, napakalinis po ng lungs nila. And usually mild lang talaga yung disease. But of course, they still take up space in the hospital. So we really have to triage properly. Yung pag-boost po natin was a very good decision because the data is showing that boosting further protects against hospitalization and transmission. We have to protect our healthcare system. Marami pong healthcare workers po ngayon, Mr. President, ang nagkakasakit na even though mild naman yung nakukuha nila, it's still a strain on our healthcare system kasi wala ng nurses, wala ng doctors. Pati ako po, parang tinda ko kasi may exposure po ako, although wala naman po akong sintomas and my last test po was negative naman, but I need to quarantine because na-exposed po ako. So we expect very high numbers of infection, but if many of us are vaccinated, we will be okay po, Mr. President. Thank you very much.
Okay, yan, mga ka-alert to. Sabi ni Dr. Silvania, kailangan pa rin natin mag-face mask. Yung mga basic ba? Face mask, facial, at yung kailangan pa hugas kamay, alcohol. Kung maaari, stay at home ka na lang kung wala ka namang gagawin. Kung may trabaho ka, dapat lagi kang may face mask. At napakahalaga din malaking bagay po yung bakunado ka na. At lalo na kung mas matibay po kung naka-booster ka. Dahil kung tamaan ka man ng sakit na ito, mild na lang po. Sana po mga ka-alerto, meron tayong natutunan at meron tayong alam sa mga bagay-bagay na ito para hindi po tayo kinakabahan. So, mga ka-alerto, marami pong salamat sa inyo sa inyong panonood. At kung gusto niyo po yung mga ganitong video, paki-like na lang po, paki-subscribe at paki-pindot na lang yung notification bell para po updated po kayo. Maraming pong salamat at mag-iingat po tayong lahat.